My name is Erick and I'm currently enrolled in the LVN program at Healthcare Career College.
My name is Diamond Young. I'm in the LVN program.
Hi, my name is Anamaria Gomez, and I am an LVN student.
So my name is Sade. I'm in the LVN program.
I feel like taking a CNA course, in my personal experience, was, if not one of the best decisions I've ever made personally. It just gave me that insight of being on the floor, that being able to, touch that warm water where you're just comfortable being able to take care of somebody, being on the floor, meeting so many ethnicities, personalities, characters, all the above. I feel like it just brings it all together. Once, you're able to see everything that's on the floor, and once you see it on the books, I feel like it all comes together.
I feel that it's important to start off as a CNA. Personally, to me, it's because it's to get your foot in the door, to see if it's something that you actually want to do before just jumping right into something more like that I feel that you may need a little experience for. So like you'll be able to better understand patients, like their needs and ways to help them more, instead of just trying to just jump right into something that you have no idea about.
I decided it's a stepping stool. So becoming a CNA was very good because I was offered in high school. So now that I'm 20 something plus years later, I decided to go back for LVN because of the experience. And I feel that starting with CNA to become an LVN is good because you learn as you go. So when things are projected to you from LVN standards, you will understand because you have already started working in that field.
So when I started my path, I did medical assisting. I was very fortunate to get in, and I looked at that as the stepping stone to my next, path career-wise, what I wanted to do. So medical assisting, it taught me a lot. It taught me, okay, am I doing the right thing? Is this what I want to do? And it also motivated me to want to do more. I wanted to help more. I wanted to touch people more. I wanted to reach out to more people. So a medical assistant is like that stepping zone. It's kind of, okay, I'm in the door, but where do I want to go? Do I want to go here? Do I want to go there? I feel like you're at that point in medical assisting, like, okay, well, do I want to work with kids? Do I want to work with the elderly? Do I want to work with adults? So I think it's just like a stepping zone to get your foot in the door. But now the door's opening. Where are you going to take that door to next? It's like the revolving door. That's what it's kind of like. Okay, the door's open. Where are we going to go next? What door are we opening next to that next step?
Benefits of starting as a CNA, moving on to the LVN there's a lot of benefits actually. You get to take care of somebody with throughout their activities of daily living, as it is day by day. You get to meet somebody's habits, somebody's likes, dislikes, not just for that person but for 7-8 others, patients that you have. And I just feel like it just gives you that that heart to be able to, that compassion, especially it gives you that compassion. It gives you that patience. I feel like that patience is essential. If you don't have that patience as a CNA, I feel like, there won't be any patience as an LVN. So it's something that you can build, and it's just like nursing can be just like a building, If you don't have a solid foundation, then the top is just a little shaky. I feel like it's the same thing with being a nurse. If you don't have that CNA foundation, then I just feel like you feel a little shaky, but of course, I think the biggest benefit is just being able to be in that comfortable zone where you're able to take some care of somebody, and it's just like taking care of your mother.
I feel like the benefits are you'll be able to better understand patients. You'll be able to understand sometimes if they're frustrated, you'll understand why. You'll be able to better get to know different type of patients, so you'll know how to deal with certain type of patients, instead of just starting off and then you're frustrated because you don't really understand why the patient frustrated. So if you get to start, I say personally at a CNA level, so you can be able to just understand different patients and different personalities and learn how to deal with them.
It helped me a lot. I understand patient-centered care. I understand the disease process. I understand the different type of people that we'll work with. I mean, it helps you mentally and physically, because by the time you become an LVN, you will already know with some type of knowledge from being a CNA in that background.
Well, one thing that helped was the injections. I know that. So I felt a little at ease with that. The difference though, with MA, you are either in the front or the back. So if you're in the front, you're dealing more with patient insurance, medical billing, appointments, whereas in the back, you're more hands-on. You're taking the patient in, doing their vitals, getting the room ready for the doctor to come in, doing injections. So there is a difference, but like I said before, it's that tool to help you. So in some ways it helped me, but then some ways, okay, now here's the big step. It's more knowledge, more fundamentals, more diagnostics, because in MA, we didn't really do diagnostics. You're not seeing what's wrong with the patient coming in, looking at their signs and symptoms and figuring out what medication to give them or what test to run, or it's a lot different. But once you have that mind frame, you're able to see the similarities, but you're also able to see the differences. So it does help you, because if you just go straight into LVN, you're like a chicken with no head running around trying to figure out what to do. So we all start somewhere.
My advice to other fellow students would definitely be to study and read a lot. And if you thought you read a lot, you didn't. So read and study more. Don't be afraid to put yourself in an uncomfortable position. Make sure you hold yourself accountable, and be a risk taker, because there's more time than life. And always remember that nothing good comes easy. So, always work hard and strive higher.
My advice is to never give up, no matter how hard it is, because you got to remember, in the future, you don't want to be stuck. You don't want to be stuck. I mean, it's good to start somewhere, but don't just stay as a CNA.
If this is your field, be serious about it. It takes a lot, mentally, physically, emotionally. It's very in demand. You always have a job, and it's something interesting because you learn your body, and the body is a beautiful thing, which I didn't know until I got in the field. And it's really interesting, and you'll be amazed at the things that you know and how the body works and how we will go through things from infancy all the way to old adult age.
I mean, there's going to be stones thrown at you. There's going to be a lot of things, but take it with a grain of salt and keep shaking and keep doing you and keep chasing your dreams. Because at the end of the day, it's you. You're doing it for yourself, for your family, for your kids, for whoever. But it's you. You're the one that decided to come here. You're the one that decided to, let me take that next step. Let me complete my goal of whatever it is. Whether you just want to be an LVN, good for you. That's what you want to do. But if you want to go to the next step, use this as an opportunity to gain knowledge, gain the skill, just gain fundamentals, just prepare yourself, and don't ever give up. Don't let anybody tell you different. Don't let anybody bring you down. Just take all that negativity away, and if you have to delete social media, delete your social media. But do it, and then just do it proud, and that's you who did that, and just never give up on your dreams. Never.